My name is Zorina Galis. I currently work at the Heart, Lung and Blood Institute, National Institute of Health in Bethesda, Maryland. I presented today a few concepts about the vascular remodeling, specifically how basic science in the area of vascular remodeling has been used to inform clinical management of patients with cardiovascular disease. This is sort of a 20-year anniversary of the concept of vascular remodeling. In the very beginning, we were very concerned about the fact that the arteries may not be able to remodel in order to adapt to the growth of the atherosclerotic lesions. However, based on pathological observations, we're able to see that, especially in atherosclerosis, the growth of atherosclerotic lesion leads to the outward remodeling of arteries, and hence the problem is not so much the size of the lumen, but what happens in the atherosclerotic lesion. Since blood vessels are held together by vascular extracellular matrix, we proposed in the early 90s the concept that degradation of vascular matrix is what helps remodeling. We were able to show that enzymes previously known in the field of cancer called matrix metalloproteinases are produced by vascular cells and inflammatory cells, and these were involved in remodeling of the arteries, specifically in the remodeling of the vulnerable shoulders, what's now known as the vulnerable shoulder of the atherosclerotic plaque. A variety of factors, the usual suspects, leads to increase of both expression and activation of these matrix metalloproteinases, and this includes cytokines, inflammation, shear stress, oxidative stress, and others. So the important concepts that I showed today is that the basic science that indicated what are the major drivers of vascular remodeling, that is inflammation, oxidative stress, and mechanical forces, are inducing remodeling via a variety of effectors such as the matrix metalloproteinases, and this leads to remodeling either inward of the arteries, which reduces the lumen, or outward, which preserves the lumen but produces mechanical instability. So these concepts were used in order to guide the development of new imaging modalities that are now looking more at the composition of the plaque, such as thickness of the fibrous cap, presence of inflammation, presence of specific molecules such matrix metalloproteinases. And we also raised awareness of the fact that the remodeling is very complex. Even in the same artery or in the same patient, you can see both inward and outward remodeling, but the outward remodeling has been shown to be associated with instability. So arteries that remodel outward, or they have a large macrophage content, or experience intraplaque angiogenesis, a process that we identified as vasa placorum, are more prone to rupture and therefore are in need of management and intervention. I think it's very important because I see it's a nice combination between basic science and clinical science, and the sessions have been organized in such a way where the two interact. And therefore, I think it's a great opportunity to learn from each other, to inform each other's research.